strikes me that the Senator's amendment is very straightforward, very simple, and very clear. And that is that any savings that come out of the Medicare program cannot be used to fund a new entitlement program. In other words,
it's not related to seniors.
Correct. It's not related. And to me, it seems at least that your amendment gets at what some on the other side have argued through their amendments they are trying to accomplish. Could the Senator from New Hampshire describe how the legal effect of his amendment differs from, say, for example, the votes that we've had where it was a 100-0 vote the other day on a Bennett amendment, what the impact of the Senator from New Hampshire's amendment would be relative to some of the previous votes that we've had, which it appears to me at least were completely meaningless, sort of cover votes to try and give people on the other side the opportunity to say, we voted to protect Medicare, when in fact they didn't. How does the Senator from New Hampshire's amendment, how would you distinguish your amendment from those that have been voted on previously?
My amendment has force of law behind it. Those amendments had no force of law behind them. They have no effect at all. They were just, as you said, a political statement, an editorial comment, a piece of paper written. This amendment, if passed, will have the force of law behind it and will very simply is structured in a way that the money cannot be taken out of Medicare if it's going to be used for the purposes of funding the new programs in this bill, whether they're the entitlement programs for people who are not seniors, this expansion of entitlements, or whether they're for the purposes of getting votes to pass the bill.
So if a senator on either side of the aisle, a Republican on this side or a Democrat, was serious about protecting Medicare and ensuring that Medicare's solvency is protected in this debate, and that these funds are not going to be reallocated to create some new entitlement program or spend money on some new, clearly $2.5 trillion expansion of the government, which we know is going to require enormous amounts of revenue, which seems to me has to come from somewhere. What the Senator's amendment would do is simply say, and force, I think, the other side to really put up or shut up with regard to this argument that they have, that they are, in fact, supporting Medicare. The Senator's amendment would essentially say very clearly, in a very straightforward way, that funds that come in out of savings in Medicare have to be retained in the Medicare account.
That's correct. This is the first and only vote that members on this floor are going to have to make it clear that Medicare dollars will not be used for something other than Medicare.
We heard the majority leader, Senator Reid, come to the floor just a few minutes ago and talk about how this bill was going to get premiums under control, keep the cost of people who have insurance, keep their premiums under control. Now, I saw a chart from the senator from South Dakota yesterday that said for 90% of Americans, those who have insurance now, that if we did nothing and did not pass this bill, that the premiums would be lower than if we do pass this bill. That passing this bill is actually going to raise premiums in spite of the fact that the President of the United States promised while campaigning that he would lower the cost of premiums for American families by $2,500. So I would ask my colleague from South Dakota, isn't it true that if this bill passes, Americans feeling they've been promised that premiums would be reduced, aren't they doomed to disappointment?
Well, the senator from Wyoming is correct, and this is where the real rub in this bill comes into play, because what we were told and promises were made, of course many promises were made throughout the course of the campaign, most of which will never be realized with this legislation. There was also a promise made that taxes wouldn't go up for people making less than $250,000 a year. Not payroll taxes, not income taxes, not any kind of taxes. And in fact, we now know that 38% of the people who make under $200,000 a year are going to see their taxes go up under this legislation. So promises are made during a campaign season tend not to necessarily be adhered to when it comes time to legislate and to actually to follow through, and I think that's clearly the case here. But with regard to the senator from Wyoming's question, the whole purpose of health care reform, at least as I understand it, and I think for the most part the people of South Dakota who I represent understand it, is to lower costs, because everybody complains. The thing you hear the most, and you go back, and Senator from Georgia is here, if you go to Georgia, Wyoming, South Dakota, I think the thing you would hear most frequently from people in our states is, do something about the cost of health care. We have these year-over-year double-digit increases or increases that are twice the rate of inflation, and we're dealing with this. Small businesses are dealing with it. More and more people, families are struggling with the high cost of health care. Nobody argues that. I mean, obviously, we all, I think, basically accept the premise that health care costs have been going up and that health care reform ought to be focused directly on trying to get those costs under control. The irony in all this is that after cutting $500 billion from Medicare in the first 10 years, and if you go into the fully implemented time period, it's about $1 trillion, and $500 billion in tax increases, what happens with premiums? Well, according to the Congressional Budget Office, 90% of Americans would be the same or worse off. In other words, 90% of Americans would see no improvement in their health insurance premiums. In fact, if you buy in the small group market, if you buy in the large group market, your premiums go up by about 6% a year, year over year. In fact, a family of four, let's just put it in perspective that an American family can understand. And that is, if you're a family of four, and this is according to the Congressional Budget Office, if you're a family of four that's paying $13,900 for insurance this year, and you're getting in your insurance in the large group market because you work for a large employer, in 2016, your insurance cost is going to be over $20,000 a year. In other words, your insurance is going to go up from just about a little under $14,000 to over $20,000 a year in that time period. So what American in their right mind is going to say, that's reform? I think most Americans are going to say, what are you doing? You're spending $2.5 trillion. You are raising my taxes and cutting my parents' or my grandparents' Medicare benefits. For what? So that my premiums can stay the same or go up? If you buy your insurance in the individual marketplace, your insurance premiums, according again to the Congressional Budget Office, are going to go up anywhere from 10 to 13% a year. So you get Medicare cuts, you get tax increases, and for 90% of Americans, you stay the same or are worse off. In other words, your insurance premiums are not going to be impacted. You have achieved the status quo, or worse yet, your insurance premiums are going to go up 10 to 13% if you're buying in the individual market. That is according to the Congressional Budget Office. And so I'd say to my friend from Wyoming, the point that you make is exactly right. We're doing all this, and the exercise ought to be about reducing costs. Clearly, that's not the case with this legislation. The Senator, of course, is one of the only two physicians in the United States Senate, has great experience and great depth on this issue and knows what it's like to serve and provide health care services to people in rural areas like Wyoming, like South Dakota, in some places of Georgia. But I think what's interesting, too, and the Senator from Georgia was here, as was I. The Senator from Wyoming I don't think was at the time, but 3-4 years ago, 2005 now, we had a debate about Medicare. The Senator from New Hampshire proposed cutting $10 billion in Medicare, taking $10 billion over a 5-year period, or about $2 billion a year, and paid for it by income testing the Part D benefit that people got. In other words, the premiums that are paid, those who are in the higher income categories would have paid a higher premium for their Part D drug benefit than would those in lower income categories. You would have thought the apocalyptic pronouncements and predictions around here about what that was going to do to Medicare. $2 billion a year over, or $10 billion over 5, $2 billion a year, and you heard the other side describe it as immoral, it was cruel, it was a disaster of monumental proportions. Those were some of the, that was some of the terminology that was used around here at the time. That was for $10 billion over 5 years, and that basically was to say people who have higher incomes, the Warren Buffetts of the world, ought to pay a little bit more for their prescription drug benefit under Medicare than those in lower income categories. And people just went nuts. On the other side, went nuts about that. And here we are talking about cutting $465 billion over a 10-year period, $1 trillion over 10 years when it's fully implemented. And it seems to me, Mr. President, that, and I would say to my colleagues, that the other side's going to have a lot of explaining to do to the American people about why $10 billion in reductions was immoral, cruel, and a disaster of monumental proportions, but cutting $500 billion out of home health care and nursing homes and hospitals and everything else somehow to pay for an entirely new entitlement program, $2.5 trillion expansion, to somehow make sense.